Thank you so much for the invitation to speak about positive health. I'm a general practitioner in Utrecht, the Netherlands, and I always I apply positive health in my daily practice, and I really see how this empowers citizens. So I'm pleased to explain you a little bit about the background and how this broad perspective on health can support personalized care, this empowerment, but also resilient communities. And if you see this picture, I already heard this earlier in the first presentation, we really are brought up and living and working in a disease-oriented care system. And we would like to go much more to a health-oriented care system. And I think positive health could contribute. I'll give you a short background about the definition of health. What is positive health and how has it been elaborated in the Netherlands? What could be the benefits? How can it support citizen empowerment? And how could this facilitate all the transformations you are working in and empower you in the health and care? So if we talk about the definition of health, it's still the WHO definition from 1948. You see the picture, it's, the society definitely changed, but the definition didn't change yet. And it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Since then, it has often been criticized, but never changed. And about 10 years ago, the founder of the Institute of Positive Health, Machtel Huber, she's here on the left, she was in discussion with a lot of international researchers and professionals, and they debated and said, maybe this definition should change. And they came up with a new concept, health as the ability to adapt and to self-manage in the face of social, physical, and emotional challenges. And there are a lot of challenges in people's life, sometimes also as we had the COVID pandemic, but sometimes also closer to people's own living surrounding. Anyway, this 10 years ago has been elaborated in the Netherlands with a study. I'll explain you a few things about on individual level. And this is called Positive Health. And our colleague Alex Shadat, he is from Canada. He's originally from Colombia and worked also in Canada. And he elaborated this concept on community level in trusted networks. And last November, there was a meeting, and there are these two movements came together. It's mostly about meaningfulness and trust, and it's still about redefining health. Well, maybe it's good to realize if we're talking about health and healthcare, as I earlier said, it's mostly disease-oriented, but there's also a lot of movements going on. We are in a transformation at the moment. And I want to show you a few movements going on at different perspectives. The first one is on costs. This is a picture, it's a situation in the Netherlands, but I guess in many countries this is comparable. On the left side is a pyramid, and in the Netherlands, there's all the money spent on healthcare is mostly spent on disease care. All the blue areas, mental care, hospital cure, long-term care, integrated first line, this is all disease-oriented care, and just a little bit is spent on prevention. I think in this transformation, it needs to shift. So if you go to this right pyramid, you see that there is a much broader base of prevention, self-management, empowering people, empowering communities, digital transformation, to make sure that we can keep delivering the care which needed. And of course, there's still hospital care nodig, and there is also still primary care necessary. But this is one perspective. The other perspective is that we move from the more medical curative model, as Jim just said, to the more interconnected health networks. So we really need to change also the way of organizing ourselves in working in healthcare. And you could also say we should move from eco to ecosystem. So we actually are there surrounding people and see what they need, what matters to them, and what they need from people around them, from people in the social care, from people in the community care, and maybe sometimes they need something from out of the medical care. So it really needs a different perspective. There's another movement going on, and Gonul, you already explained about this digital transformation, really important. We want to personalize more what the care is. It's not one size fits all, and we definitely have to include, it's an inclusive society, so we want to be there for everybody. So how do we find out what people need? How do we empower citizens and what matters to them? And what can people do themselves? and what can we learn from good examples, as for example, the blue zones in the Netherlands, where people get old on a healthy way without chronic diseases, without being mentally, without mental diseases. And there the clues are, of course, healthy food and enough movement, but two other things are really important. This is meaningfulness and the social participation. And these things, I think we definitely all also experienced this everywhere in the COVID pandemic, how important this is meaningfulness, and also having a reason to get out of your bed for the ideal, but also have people around. Like social isolation is really sick making. So what is the bridge to positive health? Positive health has been elaborated of what I just said, this concept of health as the ability to adapt and self-manage. And in the Netherlands, we did research to find out how could we apply this into practice. In this research have many people been asked, like, what are like indicators for health? And in total, we had 500 indicators, which are grouped into these 6 dimensions: bodily functions, mental functions, the meaningfulness, the spiritual existential dimension, quality of life, social participation, and daily functioning. And when out of this research, these 6 dimensions were grouped, they also did research to check among 2,000 stakeholders if they agreed that these 6 items did belong to health. And it turned out that, I didn't bring this picture, that patients see all 6 dimensions as important. There were some differences that doctors, but also policymakers and insurances, they said, I'm not sure if this social participation and this meaningfulness belongs to health. But the group researchers decided to follow the patient, because if we deliver personalized care, we need to know what's important for the patient. And all these 6 dimensions are important in health, in being healthy. How did they use this in practical point of view? They made a picture of, well, we call this a spider web of these 6 dimensions, and you can ask people, how do you experience your health on these different 6 dimensions? And people can fill in easily. They rate between 0 and 10 on an average, but we also have this online in the digital tooling. But they can rate themselves, and then they have like a reflection of how they feel about their health at that moment. It's of course a moment, because it can differ. If something happens the day after, can already be different. But at least it gives like a kind, I always call it in my practice, it's kind of a temperature of how you feel about your health. And it doesn't matter if you talk with someone about this. I ask like, what's important, what matters to you, and where do you want to start? And it doesn't matter where people start, but that they start. Because if you make a very small step, this will also influence the other dimensions. This is all like come together in one, we call this spider web, with here a little bit more text with different aspects which belong to a dimension. And this is all based on this research done. We have this in English, it's just translated in German, Icelandic. There's a group of Icelandic people already taking the training. Tonight I'm talking with people from Canada and Colombia who also want to have this in Spanish, and there's a Portuguese group active in translating the spider web. But most of all, yeah, as I said, it's usable in the conversation for me in the role of professional with my patients, but I see it, many professionals can do this. Social workers can have the conversation, physiotherapists, psychologists, but also people in my community, volunteers, are having this conversation with other people. And working with positive health is about 3 elements. First of all, you ask people to fill it in. And this is a reflection on your health, on your life. This is called My Spiderweb. The second element is the conversation about what they see. So what really matters to them, not what's going bad, but what matters to them. And is there something small they would like to change? And what I experience every day when I work with this is you really get to the intrinsic motivation of people. If you really talk about what is important to you, and everybody, even in the health literacy, everybody can tell and say, okay, my children or my family or my work or whatever, what matters to you, and what small step would you like to take yourself? What can you do? What can you think of? And I stopped initially, like when I started as a GP, I came with all those good advices and programs. And why don't you go there? Why don't you do this? And did you know that we have this great lifestyle program? But I stopped giving suggestions and advices. I have these 2 questions. What matters really to you? And what small step could you make? And then that brings them to actions. And also we talk about the barriers. Like, of course, it's difficult. Behavioral change is difficult. But if you say, okay, what is it? What could the barrier, and what is it what you need to overcome these barriers to actually do what you really want? Because this is something that's important to you. And this really brings different conversations. We have this in the Netherlands in different tools, the adult version, there's also a children version. Sorry, this is in Dutch, but there's a youth version and there's a simple version. And this is for the people with low literacy, because they only have to say yes or no, but we still have this conversation about what's important about these different dimensions. There is a small flyer. I would like to go in now where this is elaborated in the Netherlands, because it's not only in the consultation room of the doctor-patient, but it's also broader. We had now 10 years working with Positive Health in the Netherlands, and this picture is from our policy document from our national government, and they really also embedded this in the policy in the Netherlands. And of course, it's still difficult. It takes time to feel this on all levels of health. They're really also talking now about we should see health broad. We should connect with education and social work and the health department to see that as positive health is the umbrella, but that's also underlying problems, of course, affecting people's life and people's health, and that you need cooperation to work on this. And this is the picture which you can, in one overview, see what positive health could bring. You see that you can use it on different levels. The lower level, the orange one, this is the level where in a consultation room, there's a conversation between patient, citizen, and professional. There is a practice level, so you can also work with positive health with your team. In my team, we have the general practitioners, the nurses, all assistants, and we all have a policy that we look broad, but also that we take good care of our own health, and that we also make sure that there's enough work pleasure and not enough work pressure. We can also work together in the communities on this broad vision of health, and also on the regional and the local and the national level. And just to summarize is that what brings positive health is that it gives a shared language. It gives a shared language among professionals from these different public health, municipalities, health promotion, primary care, hospital care professionals. And it also supports community projects. As I just said, we have in our neighborhood also the social prescribing, and then they start having this positive health conversation. The welfare coaches start to talk with the people about positive health. But I refer, like people come into my practice with physical and mental problems. And then we have this conversation. I ask what's important for them. And if they say, I feel lonely or I want to do something in my area, then I know that there's a lot of places in our community where they can go to. And this is the community model where positive health is also used for policy documents. And then they say, okay, how are these 6 dimensions also how do I say, yeah, facilitated in the community? So is everything there to, if people come with issues, they can actually find their ways in the community. And my last slide is also again for this community, like the people are in the center, and you have like neighbors, friends, families, volunteers, etc. And then you have like social and medical professionals in the areas, only there when they need a little bit of help. But what I say, I spoke today to a few of my colleagues, and in the past, we as medical professionals thought that we were the center, and that of course everybody should come to us and we would explain what was good for someone. But I think this really is a change in culture, and I think it empowers the citizens to tell what they need. And I think positive health could be a tool to support this whole different perspective. in health. So I'm curious, like, what are teams topics for you in your local communities? How can positive health contribute to citizen empowerment and community care in your area? Because positive health can really, it touches nutrition, movement, meaningfulness. It gives overview of the life of people. It gives grip on their life, and it addresses meaningfulness. And it takes collaboration within the disciplines in a network community. So it's a new concept. It empowers citizens. It's a practical tool, and it's a movement to actually support this transformation from disease-oriented care to health-oriented care. And what I think professionals, I'm used to care for people, but I think for this positive health conversation, I just changed a little bit to supporting that people find their own next steps based on what matters to them. So if you're inspired, there is, we published a handbook, Positive Health, where a lot of information is mentioned about what I now had to tell in 15 minutes, so I went a little bit quick through it. The spiderwebs you can find on the free downloads, and if you want information about training in Belgium and Germany, we're training live, and furthermore, we train online. So I hope you're interested, and I hope positive health can also be used more broad than only in the Netherlands.